If I have a line of tension in a latissimus, exactly the way we found it earlier, and I decide now, holy crap, I have the opportunity to do something. The specificity now is actually establishing a contact. Your contact is the first directional load. So, line of tension here, I'm assessing, I say I have an outcome right here under this finger. So if these hands aren't, the rest of my hand is not important, I back this off, I establish a directional contact. Second thing that we have to do, move right back into that line of tension. But now we're in a battle, okay? Before we just assessed things, so we just felt that line of tension ramp up. Now, we have to be directionally loading into that line of tension with a little bit more force than is coming at us. Why? That helps us win. That helps us win the battle, because that is what the tissue is going to feel. It's going to feel our directional load as we battle it. Okay? And we continue to move. So now we're taking a directional specific contact. We move back into the line. I don't just hold that for 2 minutes. What I'm going to do is I'm going to start to move more. I'm going to start to turn this way. I'm going to start to continue to pull that tissue, create more length in that tissue. Because what will happen is strain will go up. I just continue directionally loading as I do that. Okay? At any point in time, as you're doing that battle, switch from directional specific stuff to pale isometric loading. Right? And then you can use the continuum of isometric loading on the pale side for however many contractions you would like to do, for however long a time you would like to do them. And then you go, okay, well now I'm going to switch back to my original, which is directional specific. Line of tension still there. Directional specific loading, continue to move. Okay? So you're always trying to push the length. You're pushing the length by feeling stress coming at you so that you can directionally load it. And then you're stopping at certain points in that length to isometrically load it. That helps you with time under tension, which should be minimum 2 minutes. So are you going to do that for 2 minutes? Of course, you're probably going to do it for a hell of a lot longer than 2 minutes. When you decide that this is not there anymore, that outcome is not there anymore, then you did a good service. Change the outcome measure. If you still feel like there's other tissues to assess, you go ahead and assess them. If there's other findings to address, you go ahead and address them. But you're not done until there's no findings, which hypothetically does not exist.